Hello and beautiful Friday to everyone here in the Priority Mail family. This is your boy Eric, owner and CEO of Priority Mail LLC, where men's health is the priority. Hey, there's some information I got hot off the press that I want to share with you all, and I hope I can keep this video under the 15-minute time frame that is required for Instagram TV, IGTV, because I don't want to belabor the point. I don't want to keep it too long, but I need to answer these questions and put these myths to bed right now. So, I teach at UT School of Nursing here in Houston. I teach the FNP program, and I have a lot of experts that I have an opportunity to dialogue with on a regular basis. And y'all, for those, again, people like to check receipts because they don't believe stuff. Here you go. There's my UT ID. I'm an FNP instructor at UT. Love what I do there. But I also have the opportunity to speak with experts in the field. And again, I don't know everything. So when I don't know something, I'm inquisitive. I reach out to the other experts that I have access to. So if I can't answer your question on this platform, y'all, I promise you, within my circle, guess what? I got somebody can answer that question. So we got facts and versus fiction right off the press here from my UT colleagues. So I'm going to share with you here real quick because there's a lot of information circulating out there, y'all, and some of it's not good. And I want to make sure we deal with some of this right now. So I'm going to talk about the facts. I'm just going to talk about the myths. We're going to put a few common myths to bed right now. Then I'm going to hit you back later. We may talk about a few other things that I have gotten questions about from some of the followers. And if you have a question, y'all, I don't ever want you to feel like you can't ask that question to me. And no question is a dumb or stupid question, okay? I don't want you to ever feel that way because the dumb or stupid question is the question that you don't ask. I don't want you to ever feel that way. I'm going to shoot it to you straight. I don't know everything, but if I can't answer it, I'm going to get the answer for you because I want to make sure I want to educate you on everything that we can talk about on these platforms and any concerns you have, okay? Yes, my men's health is my specialty, but I'm here to educate the people, okay? Now, let's talk about this. Myths. Myth number one. Vitamin C can fight off, and this is straight from my UT colleagues' website here at UT, all right? Myth number one. Vitamin C can help fight against the virus. There's not enough scientific evidence to support this, y'all. There are a lot of people on YouTube and out there in these Facebook and Instagram streets saying that vitamin C will boost your immune system. Vitamin C does help, and you can get it in a number of forms, but do understand your body has a certain amount that it can absorb, and the rest is just urinated out. Okay? Hope that answers your question. I got some emergency in my pantry right in there now. I've taken it before, but knowing what I know and what I just shared with you, taking excessive amounts of vitamin C, you're just peeing it out. Okay? Because your body is only going to absorb so much. All right? Myth number one. Myth number two. The virus will die off once temperatures rise. There's a lot of things circulating out there, y'all. They're not accurate at all. There's some about drinking hot water, drinking hot tea, using a blow dryer to blow the virus out of your nose and your mouth, and the temperature outside, or raising the temperature inside, or getting in a sauna. None of that's accurate, y'all. We hope that the virus will disappear during warmer months, but that's not accurate. As you know already, seasonal flu, we see it all the time, during almost year round. We do know there's a peak time during the year, season-wise, that it is really prevalent, but it can happen any time of the year. So raising temperatures, drinking hot water, using blow dryers, not accurate. And it may mirror the seasonal flu, and then it may still linger on into the summer, as has already been alluded to by the Corona Task Force. Next, myth number three. Drinking water every 15 minutes reduces your risk of contracting the virus. Not accurate. I can see the logic, though. I can see where people think that if I got the virus in my mouth, nose, and if I'm drinking and flushing it, it's going. No, not accurate. It's great to stay hydrated because hydration helps you on so many other levels with your bodily functions. And on a cellular level, it does help if you were to get a virus, whether it's coronavirus or not, for the white blood cells to fight it off. So being hydrated is a plus. And you want to make sure, again, on your cellular level, the basophils, white blood cells, neutrophils, all those different that make up the white blood cell army, our immune system, you want to have adequate hydration within your body. But drinking every 15 minutes does not help with the virus at all. Okay. Myth number 4. The mask protect against COVID-19. Not accurate. And here's one. A lot of you see this mask. You may have this mask. You may have access to this mask. Doesn't protect against COVID-19. Barely protects against the pollen outside right now. Okay. And if you're wearing that mask, all you're doing is adding to the anxiety and the fear that's already out there. And it's a face accessory right now. You don't need it. And it's not recommended by CDC. Okay. So put the mask away, y'all. And the mask that you really need, you really don't have access to, is called the N95. We wear those in healthcare to protect ourselves from the patient so we can provide care to the patient. And those are some really good masks, but you don't really have access to that. And they're trying to find a way to get more because of the influx of coronavirus here and the care that's going to be needed moving forward. All right, myth number 5. COVID-19 or coronavirus can mutate into a deadlier strand. Yes and no. And we don't know where this is going yet. The evolution of the coronavirus is ongoing. And as you have been paying attention to the media and all the information that's been shared, we don't know where this is going. And it could possibly mutate. But to say it's mutated yet, we don't know. And whether it's going to be deadly or not, we don't know. But we do know that the flu virus is notorious for doing this. That's why we create vaccines for it every year. But we don't know yet with the coronavirus if this is going to happen or if it's already happened. So don't run too far with that. We'll come back to that at some point in the future if this comes up again. So got it. Next. Using hot water to wash your hands will get the germs off better than cold water. Not necessarily accurate, but I understand the logic. We all think that hotter is better. Hotter kills. It does kill a lot. Okay. But in this situation here, think about it. You don't want water hot enough to boil hot dogs in trying to wash your hands. Who's going to do that? I ain't doing that one. But if it's lukewarm or relatively warm, the key with all of this, y'all, is the timing and the technique. And I may have to wash my hands and show you all this, but it's all about 20 seconds with an appropriate amount of friction, cleaning your nails, and singing happy birthday or singing your ABCs, and an appropriate foam or liquid form of antiseptic antibacterial soap. That's the key. Timing and technique in 20 seconds with the technique. The water can be lukewarm. It can even be cold. It doesn't necessarily have to be piping hot. Okay. So I don't want y'all to get 2nd-degree burns, trying to wash your hands over the stove. Don't do that. Okay. And then lastly, I want to say there was a request. Well, there's a question that I saw. Someone sent me a video, and I appreciate you all chiming in and confiding in me enough to feel that I can answer your question. And if I can't, I promise you, y'all, I don't know it all, but I promise you, I'm going to get you the right answer, because within my circle, somebody has that answer. So the FDA, there's a question about whether ibuprofen has caused a worsening of COVID-19 symptoms, or people that get it, if they take ibuprofen, they're going to die, something like that. So ibuprofen comes in many forms. You can buy it over the counter. It does not require a prescription. And ibuprofen is Motrin, Aleve, naproxen can somewhat be, depending on some forms, can be that. But it is an NSAID, a non-steroidal anti-inflammatory drug. And those drugs are really good for general body aches and pains that we typically take if you have like arthritis. They also have the ability to reduce fever, or what we call antipyretic factors or abilities, where it can reduce the fever in a body. So in pediatrics, you'll see, like, your doctor will tell you, you can give your baby alternating Tylenol and Motrin, depending on what's going on, every few hours, okay? Because we know it can help with fever reduction as well. but it's not known, and this is directly from the FDA. I'm reading a statement from my other laptop here. So it says, according to the agency, there's not enough scientific evidence to link the use of NSAIDs, ibuprofen, to the worsening of symptoms of COVID-19. Okay? So ibuprofen is safe, y'all, but this is one caveat to that. If you have underlying kidney disease, okay, you know you have kidney disease, and if you have like peptic ulcer disease, gastric ulcers, or worsening reflux, you shouldn't take NSAIDs. You should talk with your medical provider always, get their advice. But if you have kidney disease, you have peptic ulcer disease, NSAIDs, any NSAID can worsen that condition, okay? So Tylenol is always safer in those cases. But outside of that, if you don't have any known conditions such as what I mentioned, ibuprofen, following the recommendations, is safe for pain control, generalized body aches and pain, and also fever reduction, okay? So I'm going to come back later, maybe today or tomorrow, and we'll talk about the drug hydrochloroquine, or Plaquenil, which is the other name for it, the anti-malaria drug that they just talked about yesterday. The coronavirus task force talked about yesterday, that is available now to treat COVID-19 or coronavirus. We'll talk about that in a separate conversation because I'm about to reach the max here in time, and I don't want to go over that. But I hope this message finds you all doing well. Again, I'm recommending y'all stay put, wash your hands, cover your cough, wash your hands, cover your cough, wash your hands, cover your cough. And if you are a praying individual, pray. We're going to get through this, y'all. We're going to be all right. We are going to be all right. And I want to reassure you, I want to answer questions, and I want to share valid, scientific, evidence-based information with you all. Okay? If you have questions, family, DM me or message me. Some of you all may have my direct number. You can text me and I'll happily answer that question. But I want to reassure y'all, hey, I'm here. I love y'all. I'm praying for all of us. We're going to be fine. And we're going to get through this, y'all. But stay tuned. And if you don't remember anything, remember it's easier to stay well than it is to get well. #Pryority Mail, y'all. Peace. Have a wonderful Friday. Cover your cough and wash your hands, y'all. I'm going to hit you back later.